Welcome back. Shingles is a painful, blistering rash that can last for weeks, potentially disrupting work, family time, hobbies, sleep, and social plans.
Yeah, that's right. And joining us today to address these kind of common questions about shingles, we've got Dr. Zulueta and Dr. Friedland. Welcome both. Thank you so much for being here.
Thanks for having us.
Of course. Dr. Friedland, let's start with you. What is shingles and how exactly is it caused?
Yeah, thank you. So as you mentioned, shingles is a painful, blistering rash that can last for weeks and can be quite disruptive to our lives. The disease is caused by a virus. It's the herpes zoster virus, and this is the very same virus that causes chickenpox. But when we get chickenpox, the virus doesn't leave our body. It stays in our body and goes dormant, and it can reactivate years later, producing this painful blistering rash that can be quite disruptive to our lives. Now, the virus, this herpes zoster virus, when it reactivates, it's predominantly driven by increasing age. Especially as we get above the age of 50, our immune systems begin to weaken, and this allows this virus to reactivate, causing this particular disease, painful blistering rash that can last for weeks, called shingles. And lastly, in addition to age being the predominant factor for why this virus can reactivate as we get above the age of 50 and our immune systems weaken, there are certain underlying medical conditions that place people at increased risk for developing shingles. And these include chronic medical conditions such as heart disease, diabetes, asthma, chronic kidney disease, and chronic obstructive pulmonary disease, COPD.
Great to know.
Yeah.
That's good to know. Dr. Zulueta, what are some key facts people should know about shingles?
Shingles is actually a lot more common than a lot of people might think. There's estimated to be about 1 million cases of shingles every year in the United States. So, as Dr. Friedland said, if you're 50 and older, even if you feel young and healthy, you're still at risk for shingles. That's because, unfortunately, our immune systems do get a little bit weaker every year as we age, and that really puts you at risk for certain conditions like shingles starting at age 50.
But pharmacists can kind of help people understand their risk for shingles, right? How can they help?
Yeah, the pharmacist is really your trusted healthcare provider who can help assess people's risk for vaccine preventable diseases like shingles and guide those conversations about prevention. I love to talk about pharmacists in October because it is American Pharmacist Month. So it's the perfect time to remind everybody about the essential role that pharmacists play in keeping all of our communities healthy. And you can do your part too. If you're 50 and older, you can stop by, talk to your Walmart pharmacist, and have that conversation about shingles and prevention.
Are there some questions that maybe we should be asking our pharmacists, our Walmart pharmacists, about shingles?
Your pharmacist is really there to support you, so you can ask them any question that you might have. Feel free to stop by and ask about any vaccine preventable disease, including shingles. Fall is especially a great time to do that because it's right before the busy holiday season. It's also flu season, and we all know how important it is to get a flu shot. So if you're 50 and older, it's a perfect opportunity to get your flu shot, and I urge you to ask your pharmacist about your risk for shingles. If you're the type of person who really likes to make an appointment, we have that available for you on the Walmart app. It's available at walmart.com. And of course, no appointment is necessary. So if you just happen to be shopping, you can stop by and have that conversation.
Great.
That's great. Thank you both so much. And where can we go just for more information in general?
Yeah, absolutely. Just one thing about more information. About 99% of all adults in the United States over the age of 50 have evidence that they've been infected with the herpes zoster virus that causes chickenpox when we're younger. So essentially, we're all potentially at risk for shingles, but not everybody will have it. There are about 1 million cases each year in the United States of shingles. And so for people over the age of 50, it's really important to speak with your healthcare provider, including your pharmacist, during wellness visits and others to find out about the vaccine preventable diseases that you potentially could have vaccines to help protect you.
Sure.
And also that would include shingles. So in addition to other information, we've created a website at GSK called easyvax.com. That's easyvax.com. And you can go into this website, put in your zip code where you live, and it will tell you which pharmacies are available in your community that have the vaccines that your doctor or your pharmacist potentially is recommending for you. Make an appointment or go into the pharmacy. You know the vaccines are there, and you can go ahead and have that conversation about vaccine preventable diseases, including protection against shingles.
All right.
Great. Thank you both so much.
Thank you.
Thank you.
Absolutely.